yet.
So when you're ready,
All right,
let's go.
we are set to go.
Hello, everyone, and welcome to CripChat, our weekly podcast on everything disability. Today, I have with me myself, Evie, and Jonathan, as well as David Cunningham. But
Hello.
a very special guest with us today, and we'll be talking about medical professions with disabilities. And we have with us Dinesh Palipana. Good day, Dr. Dinesh.
Hey, how you
How are
doing?
you?
I'm good.
All good, all good. Take it away, Cunningham.
Thank you, Evie, and look, welcome everyone, and welcome Dinesh to you. How's your day been so far?
Yeah, it's been great. Thanks a lot for having me on.
Fantastic. So, can you tell us a bit about yourself and what got you so passionately interested in accident and emergency medicine?
Yeah, I was born in Sri Lanka. I moved to Australia when I was 10 years old. Then finished high school and did a degree in law, and ended up going to medical school because I had depression when I was studying law, and that got me interested in medicine because I started seeing a doctor. Then I got into medical school, and then halfway through medical school, I had a car accident, and I sustained a spinal cord injury after that. So I lost the use of my fingers and everything below the chest. Actually, it's the 27th of January now, so it happened on the 31st of January 2010. So it's nearly been 30 years. Yeah. And, I developed an interest in working in the emergency department after that. Even before that, I had an interest in trauma and I suppose the acute side of medicine. But the injury, after the injury, I became even more interested, I suppose, after having an experience in it. But I love the job. It's really interesting, and the patients are amazing, and the work is fascinating. So I love every minute of it.
Cool. Interesting.
Do you often find it stressful though at work though, underneath in what you do? I mean, is that a challenge for you with the pressure and all that?
So our emergency department in the country.
Can you pause for a sec, Dinesh? We got some interference, guys.
Oh, yep. Is everything good?
No, I'm hearing some people feedback.
Sorry, go ahead.
Okay, sorry, Dinesh, go ahead.
That's all right. So our emergency department.
The answer again,
yeah. Our emergency department is the busiest ED in the country. It's a pretty dynamic place to work, and there's a lot happening. But I think that's one of the allures of working in a place like that, just because it's challenging, and I think challenges are rewarding, and I find that a good thing. So I met someone a little while ago who trains elite sports people, and they were telling me that it's good to challenge yourself, because like a balloon, you stretch and stretch and stretch, and then that's how you become. That's how you grow. So I feel that this is a good thing as well. So the more, I guess, pushed you are, and the more challenged I am, I find
Yeah.
that I more and grow more. So I find it pretty rewarding.
So I mean, do you manage on shifts when you're having to like balance your disability needs with being a professional? I mean, do you find that a bit of a struggle at times, Dinesh, or not?
Yeah, that's a great question, David. Thank you. So when I came back to medical school, one of my best friends, he said, if you want to make a success out of this, you're going to have to learn to streamline everything and figure out ways in which you can, I suppose, perform the best. So
Yeah,
when I came back to medical school after the accident, I just worked out ways in which I can time everything, and I can plan everything, and I can have contingency plans for things, and I can just work things out so everything becomes seamless around the spinal cord injury. And
yeah,
that involved things like, setting up the wheelchair the right way, and having shoes that I can wear for the whole day, and experimenting with different types of scrubs. When we're thinking about skin and temperature and all that sort of stuff. So
for sure.
um,
Yeah,
and even things like eating, because a lot of people with spinal cord injuries experience a drop in blood pressure after eating, or sometimes feel a bit dizzy. So I'm the same. I feel a little bit dizzy. So I even watch what I eat and time what I eat, just so I can perform at work the best.
yeah. Of course. And so basically, so at times probably when your colleagues would have different responses too, right? I mean, sure, it'd be difficult to have to
Yeah,
like judge how people respond to you like while you're on shift, because I mean, you got your co-workers and your colleagues and peers as well. Wouldn't that be right? I mean, they'd have different
yeah.
approaches to you, wouldn't they?
My colleagues in the emergency department are amazing. They're really good, and I just
Right?
feel like a part of the team. And
Yeah,
the doctors and nurses and everyone, the radiographers, the environmental services, everyone is amazing, and I just feel like a part of the family. And similarly, many of the departments have been really good as I've worked in different ones in the hospital. But there have definitely been a select few, particularly senior staff outside of our emergency department in the past, that I've had some difficult conversations with. Um, so that's I think by and large that's become less and less and less. And as we move forward more and as time goes by, the it's become a lot better.
excellent. So I guess I mean, you'd be aware of all the difficulties and the obstacles in the health system for people with disabilities as well, would you? So I mean, how do you reckon the system actually would treat people with disabilities on the whole when it comes to public health and hospital system?
Yeah, and that's why I think that's one of the reasons why we need to have people with disability within the system, because there's a there's often a lack of understanding about what is required for a person with a disability when we're providing
Yeah,
health. And I mean, you guys would have all experienced the health system at one point or another, right? So,
we have. Yeah, we certainly have.
and we
Yeah,
all know the challenges, and even for me, right? Even when I was, even before I became a doctor, when I was a medical student, I've experienced so many different things. So yeah, I think we've got to do more to make the system better for the many Australians that experience disability, and there's a lot of work to be done still.
yeah, yeah. Have you got any questions,
So
Ibi?
yeah. Dinesh, what has been the reaction of patients when they see you on the grounds, delivering service?
That's so when I was coming back to medical school, I wondered and I was actually scared about what patients would think. And I thought, man, would they be okay? Would they? Uh, but the interesting thing is, so we're now 7 years down the track after I become a doctor, and not one patient has ever said anything like that, or reacted in an untoward way. They've all been amazing, and they've all been incredible, and I feel very lucky to be a part of their care. So the patients have been really good uniformly.
Interesting. That's awesome.
Wow. I mean, I mean, have you ever faced any like discrimination within the system, or any questions about your disability or your or
Yeah.
your or the way because I mean, basically, I mean, you would have reasonable adjustments in the workplace, wouldn't you,
So
for how you operate?
yeah, so again, I've got to say the patients definitely not, never. The system, yes, the system has been challenging. So when it came time to even get the job and start working as a doctor, when it came time to doing all that, even with certain specialties, when I was working through them, there were a lot of challenges in terms of adjustments. I mean, if you think about it, the our emergency department, we see so many different kinds of patients, right? We see hundreds of patients every day, and not all of them require, I suppose, like procedures and things that you need fine motor skills for. I've learned how to hold a stethoscope. I've learned how to examine a patient. I've learned how to do all that. So, there are a lot of patients I can see. So I just go to work and start seeing patients. And really, one of the main differences is that I use a wheelchair to do it, and I might not see patients that require complicated procedures, but most of the patients don't require that. Many patients just require an examination, and so I can do all that. And then I mostly do evening and night shifts because that just works better with the spinal cord injury and all the logistics around it. So yeah, I think we've figured out so many different ways to make it work and make it a success, and it's been really good. But it wasn't easy starting off in the system, definitely.
Wow. Yeah. And so and you'd receive lots of support from your family too, wouldn't you? I mean, how's their approach towards you and your career, what you've chosen to do with yourself?
It's mainly, it's just been me and my mum since the accident, and then family. I've learned that family isn't so much about blood and genetics, but family is what you make it. And so
Yeah.
it's been me and my mum this whole journey, but we got people that we call family now. So the team around me that support me every single day, and my close friends, their family now. So it's I suppose for all of us, by virtue of my job, it's sometimes an unusual day and an unusual journey. And I think even for most doctors, the people around them um, don't have a complete picture of what happens in our day-to-day lives at work.
Yeah.
So in my situation, it's even more a bit different. But they're awesome, and I wouldn't be here without them.
Fantastic. So and so are there times, Dinesh, where you actually wish you actually had your ability to walk again or not? And do you ever think about that? About life
I,
pre disability
yeah,
and now having it? Because many quadriplegics or paraplegics often experience the fact that they actually may miss, they miss what they used to have.
yeah. When the accident first happened, I would have done anything to have my old life back, and
Right.
turn back. Um, but today, I I just don't think about it. I mean, I love life. I'm happy. I feel like, I feel very privileged, and I feel very fortunate, and I'm very thankful. And I think someone once told me that it's not about mourning the things that we've lost, but celebrating the things that we have. And that's the approach that I try to take to life. And at the same time, we're doing a lot of research around spinal cord injury, and where all that is happening as well. But I think I'm still pretty lucky. I wouldn't be here chatting to you guys if it didn't happen. So,
Awesome.
Correct, exactly. Right.
I
Have you
guess
got any questions?
Dinesh, working in the sector can be very stressful and anxious. And every day. So how do you manage all the stress and anxiety you face?
I mean, like I said earlier, my perspective on that has changed. Like I find it, I find it to be pretty. I find that it helps me grow, and I find that it stretches me. So that challenge I find is pretty good, and I welcome it now. Um, I think and I think just everyone has different things that they do, right? Like when they get home, they might find different ways to chill out. So for me, it's actually ice cream and The Simpsons sometimes when I get home at night. So that's how I chill out a bit after work.
So there's no booze then.
No booze. No, I actually don't drink. No, not at all.
That is interesting. That's really, really good. Yeah. It's like Dinesh. So when you got your order of Australian medal, was that an experience for you and a half? I mean, did you? And was that must have been a moment for you, right?
Yeah, it was incredible. It was so it was at the Governor General's house, and it just, I don't know. I think those moments kind of remind me that they kind of remind me to do more and to be better and to give more back for our community too, right? Like the community of people with disability. Like we're all together, and we're all trying to build a better life for all of us, and to create more equity and better healthcare and all these things. So it just reminds me to work harder to do that, and that's what that moment was like for me. The actual ceremony itself, it was just super nice, and I think that's what it reminds me.
Super nice. That's a way to describe it, isn't it?
Yep.
I mean, between us all here, Dinesh, I am slightly envious of that with you.
Thank you.
It's a good thing to have, and I tell you, when you have it, people look up to you, don't they? They turn and go, "Oh, you got that." You go, "Yes, I'm one of them."
I'm actually thankful.
Always a good thing.
Like I'm thankful to the people. I feel very, I'm so lucky to have. I feel very lucky. And the other thing is, dude, I wasn't born in Australia, but Australia has welcomed me, and I've grown up here, and I'm with healthcare and education, so I feel very lucky to be here.
Absolutely,
it's a beautiful country. That's very true. Role model for us.
Any questions?
I'm just saying, in regards to the challenges and obstacles that you face as a person with disability, how do you manage to overcome those?
So what was that again, Ivy?
Sorry, with the challenges
the challenge obstacles,
that you face, how do you overcome them as a person with disability?
I think one of the things that I thought about very early on is that, we have these barriers. We might have people say what we can and can't do, and we might have these systemic issues and prejudices and whatever else, right? But what I've learned is that you get one shot at life, and it's happening now, and there's no room for regrets. So I just wanted to try and make the most of this chance I've been given, and I wanted to try and make the most of it, and I didn't want to have any regrets down the track. So when there were challenges and obstacles, I just thought, I just got to give it my best, and I just got to keep trying, because I just don't want to have any regrets down the track, and that's how I approached it. I just didn't want to have any regrets, and I just kept going. So I didn't care if I tried and failed, but I just wanted to try.
Trying is key. Definitely, it is. Yeah, especially for us all, when we push forward for something. It's really, really, really important. So like, so would you have steps that you take, Dinesh, in actually planning your goals, what you want to achieve in your life? I mean, do you take it step by step, or do you just just like wing it and go and do something? What's your approach to that?
Yeah, I mean, I knew that I wanted to graduate from medical school. Like I knew that I wanted to become a doctor because I love it so much and all these things. But these days, yeah, I think it's become more about how I can leave this world a better place and what I can do to contribute to, contribute to other people having a better life and our community having a better life and our world being better tomorrow. So it's become more and more about that, and whatever I can to do that is what's most important now. I was listening to this interview with Neil deGrasse Tyson, and he said that that is his magic motivator. It's just that he wants to leave something that betters humanity. So that's what my motivation is these days.
Fantastic. That really is really great. So I guess you would have a vision then for how our hospital and health system could be better as well, don't you? In Australia, right? You'd have that vision, wouldn't you?
Totally. Because I think I think it needs to benefit the people. I think there are so many gaps, right? There are so many gaps, whether it be First Nations people, people with disability, refugees. Like there are so many people that use the system that have gaps to access, that have the outcomes, and disability is definitely one of them. And I would love to see an accessible public health and hospital system for people with disability, where you can have excellent outcomes and excellent care, and even excellent things like good physical access and good individualized care that looks after needs, and a world where we expect a similar life expectancy and similar health outcomes, and that is what I would love to see, because we have the resources to do it. It's just about making it happen.
Absolutely. I agree with you totally. And of course, we're all with you on that one. So would you have some advice there to give about for others with disabilities who are seeking to enter the medical profession? You'd have some things to say about that, wouldn't you?
Yeah. I mean, medicine is a very broad church. There are so many different specialties. There's everything from emergency medicine to general surgery to radiology to general practice to psychiatry. So there are so many different areas in medicine that you can find a home in. It's just about finding, it's just about getting to a medical school that's supportive, and there are many in Australia and around the world that are starting to be great, and then going for it. But if you're thinking about it, I can tell you that I love this job. It's amazing. It's rewarding, and you won't regret it. And we need more diversity, and we need people with disability in medicine because it's going to benefit the community of people with disabilities so much if we have more doctors with disabilities in the system.
Agreed.
Yeah.
Totally.
But I guess as well, being a leader in the space is very rewarding, as well as being a great model for people out there for the community, and it's something you look forward to every day. Just getting up and just have that positive mindset.
Yeah,
Positive mindset. Sorry, wouldn't you agree, Dinesh?
I feel very lucky, and yes, definitely yes.
That's awesome. Awesome.
Fantastic. So, final thoughts, Ibby and Jonathan.
Ghanaian, look, it's been an absolute honor to have you, Dinesh, on the show to share your wisdom and your knowledge and your expertise in the field. I myself, would never get into medicine. But look, hearing your story, it's such an amazing work that you do, and keep doing what you do best, Dinesh, and be that great leader in your community and a great role model for everyone. Thank you very much,
Yeah.
Dinesh. Over to
Thanks,
you,
guys.
Kanye.
Yeah, and actually, like Dinesh, I feel exactly the same way. You've been a really great guest on the show today, and I tell you, we're very fortunate to have had you. So thanks so much. You're really great having you. And just hope you enjoyed your time on CripChat Australia.
Yeah, thank you, boys. The honor's all mine, and it's a privilege. Thank you for having me, and thanks for what you're doing.
Thanks, Dinesh. And look, guys, that's the episode for this week. Please like and subscribe. Remember to click the episode for your likes. Those likes help us to get more publicity and promotion, etc., for ourselves. And we'll see you all next week. Thanks so much,
Thank you, guys.
Evie, Jonathan, and
Thank
Dinesh.
you.
Thanks so much, guys.
Bye.
Thank you. Bye-bye.